Hi there. I'm here today with Val Cacho, and she is a integrative. Oh my, integrative. I've forgotten already. I'm gonna have to
That's
edit.
okay.
So tell me
That's
again.
okay. Integrative sleep physician.
Okay. And she is an integrative sleep physician and women's sleep expert. So I personally love sleep. I think sleep is a great thing. I always feel better when I sleep well. But can you just introduce yourself and tell me what you do and what all of that means and why sleep is such a big deal?
Wonderful. Thank you so much, Sarah, for having me here. I know you came on my channel once and did a live, so grateful to be reciprocating for you. And a little bit about me. I have a background in internal medicine, and then I went into a sleep medicine fellowship, and then I did another fellowship in integrative medicine. And so right now I just practice sleep medicine. Oftentimes I get asked if I do internal medicine still, but I really just geared my practice towards helping people sleep. So either people who are too sleepy or people who can't get enough sleep. Yeah.
Um, and I think a lot of people think sleep is just such a natural thing and something that we should do without even thinking about it. So how did we get so off track?
Yeah, I love that question. And how did we get off track? And I think honestly, it's society and our culture. In the US and probably other westernized culture, we're very into achieving, hustle culture. Sometimes you hear things like, I'll sleep when I'm dead or I'll sleep when I'm retired. A lot of people catch up on their sleep on the weekend. The CDC has done, really pretty good studies throughout the year, and you can go to their website and just type in, sleep research, and you can check your state to see how sleep deprived your state is. When we say sleep deprived, we see getting less than 7 hours for adults. So recommended sleep time is between 7 to 9. And about a third of us in the US aren't getting enough sleep. And I think it's just because there's just a lot going on. We live very busy lives. If we have families, and I have two young kids, sometimes their sleep can impact my sleep if they're not sleeping well. We're still working on getting the second one. He's 2 years old, to sleep independently. Working full time. Sometimes, honestly, all I know about sleep, I'm still not a perfect sleeper, and I think no one's a perfect sleeper. We just do the best we can. Sometimes I'm still doing emails or finishing up charting pretty late. But I think at the end of the day, just thinking about how important sleep is. And one of the biggest issues that I see in a lot of people is that they don't prioritize sleep. For you, Sarah, you love sleep, you know how important it is. But sometimes it's one of those things where you don't realize how impactful it can be until there's a traumatic event in your life, whether it be a hospitalization or just a period of really bad stress or anxiety, and then you don't get enough sleep. And then sometimes if you're unable to get back on track, it can develop into insomnia, where you really have a hard time falling asleep. Maybe you see your primary care physician, they give you a sleeping pill, and maybe it works, maybe it doesn't, maybe you don't want to be on a sleeping pill. So we can go into, some of, treatments for that. But yeah, I think it's just our society doesn't prioritize rest as much as we need to.
Yeah. And so why is sleep important? I mean, why is that a big deal? Because you're right. I mean, we read so
Yeah.
much about, successful people who
Mhm.
don't sleep a lot and are just so much more productive. And I think we all do admire that and
Right.
maybe want to be that person who only needs
Mhm.
4 hours of sleep a night. But why is that goal a bad thing?
Yeah, yeah, the 5 a.m. club, I think you're
Yeah.
referring to. I mean, and kudos to the people who can. There are a subset of the population who can get by on, less amount of sleep. But when you take a look from a physiologic standpoint, I like to think of it from a top-down approach, just a blanket statement, sleep makes everything better, but I'm super biased. But if you take a look at your brain, right, your body needs to rest. And even your computer has a sleep mode. So if your brain is constantly going and going and going, whether it just be you're working or you're just awake, there's different stages of sleep. Stage 1, stage 2, stage 3, and then REM sleep. Stage 3 sleep is considered deep sleep. And if you're shortchanging yourself from that deep sleep, Guess what? The lymphatic system, also known as the trash collectors of your brain, throughout the day, we develop these toxins that build up. And if we don't get an adequate amount of deep sleep, guess what? The trash collectors don't come out. And these toxins can stick around and lead to things like memory impairment, issues with performance, cognition, memory, focus, attention. I know when I don't get a good enough sleep, it takes me longer to do simple tasks like writing emails, even spelling simple words could be pretty tricky. So, yes, sleep is really important for our cognitive health. Going further down, you can think about our heart. So, for our heart health, it's really interesting. Some of the research shows making sure you get at least 6 hours of sleep. Less than that has been associated with more things like irregular heartbeat, heart attacks, or stroke, right? Because at the same time, your heart wants to relax and slow down. So, if we're constantly awake, it's going to beat faster. Your blood pressure is going to be higher. So, I've definitely seen people who have come to me maybe sleeping 5 or 6 hours. We got their sleep on track, and now they're sleeping just an hour more. And their blood pressure has gotten better. And it's just as simple as that, is that your heart's not supposed to be working all the time. What else is important? Well, our immune system. So, the University of Pittsburgh a while back did some pretty interesting research where they took healthy adults and they actually gave them a simple cold, right? Virus in their nose. And then they categorized them into like different classes, sleeping 6 hours or less, 7 hours or less, or, greater than that. And those who slept less than 6 hours, sleeping less than 7 hours, had higher rates of actually catching the cold. So even though they gave them, the virus in their nose through a little swab, not everybody got sick. And what we found out is that sleep is protective. Why is that? Because your immune system, I don't want to say boosted, but it just runs better when you're getting an adequate amount of sleep. Yeah, so those are some of the big ones, and I think another one too. I don't know if you have a lot of women on your
Yeah.
in your audience, but a lot of women are concerned about weight loss, especially as we get older. We're going through perimenopause and menopause, and it's harder to get rid of some extra weight. Probably, a lot of changes from your hormones. The lower levels of estrogen, progesterone, and growth hormone can go down. But if you're not sleeping enough, what can happen is that there's the hormones of your satiety, meaning there's a hormone that makes you want to eat more. Think of that like it's called ghrelin. I like to think of it like gremlin makes you want to eat more. That actually goes up. We know this from college students who we sleep deprive, and also people who work night shift. Typically, they sleep less overall. And they tend to gain a little bit more weight. And then the other hormone that makes you feel full is called leptin, and that one goes down. So sometimes when I talk to my patients, and we're talking about, okay, losing some weight can help improve your sleep quality, especially if you're snoring. And they have a hard time. They say, well, I'm not really eating a lot, but there's sometimes I'm just really craving, the chips, right? Sort of the fast food. And for a couple of reasons, it takes a lot of energy to plan a meal. Go to the grocery store, chop all the veggies, go back home, cook, clean. Versus, you see the drive-through, you know what you already want. It's so much easier just to drive through and then call it a day. So sometimes it's not necessarily a matter of willpower. It's almost like when you're not getting enough sleep, your body is craving those simple carbohydrates as that fuel. But really, pay attention to your bodily cues. If you need more sleep, get more sleep. And then hopefully those cravings will get better. And hopefully the weight will decrease as well.
I think that's so reassuring to
Mhm.
hear, right? Because I think a lot of women think, oh, I'm craving food.
Mm,
I just don't have any willpower. And
mm,
so I think it's really empowering to know that, there are things that impact these hormones that really do make you more hungry, make you
mhm,
feel less full, right? And then
mhm.
drive those behaviors, right? It's
Yeah,
not always
definitely.
it frequently is not a lack of discipline. And I
Yeah.
think, everything that you just mentioned is so powerful because I
Mhm,
don't think we all correlate that with sleep, right? That
mhm,
sleep really does help your body reinvigorate and just work better on so many
mhm.
levels. So, do you recommend the different monitors that you can get that follow your heart rate for sleeping and tell
Yeah.
you how well you're sleeping and what your heart rate is at night?
Yes and no. So I would say, Sarah, typically the people that come in already have a tracker. And now the question is okay, now this tracker tells me I'm not getting deep sleep or I'm not getting REM sleep. And I always like to encourage them to understand that yes, that information can be helpful, but when you take a look at the research, they're not really validated. Being a doctor, sort of a scientist as well as, I want to have good quality data. And depending on the type of sleep tracker you use, anywhere between maybe 50 to 60% up to the high 80s, maybe 90 in terms of grading the sleep stages, right? Those 1, 2, 3 and REM. For wake versus sleep, they're really beneficial. Those are only two options, right? If you're wearing it at night, it's probably a high likelihood that you're going to be asleep. So I like to look at the sleep trackers as more of getting baseline data. So say, you want to monitor your sleep because you just have been feeling a little bit off, not too sure why. Maybe you've had some blood work done with your doctor and you don't have diabetes, your vitamin D is okay, your thyroid's okay. And so, maybe your friend uses it and recommended it. What I encourage people to use the trackers for is if you add an intervention. So if you're going to cut back on caffeine, or if you're going to exercise more, right? Or if you're going to start meditating or stopping watching TV before bedtime, right? The reason for that is once you have a baseline amount of information, you add an intervention, and then you can use that tracker to see if there was a change in your deep sleep or if there was an increase in the length of how much sleep that you have. Yeah. Oftentimes patients come in with their data and they say, well, I only got, 80% of light sleep and 20% deep sleep, and it's supposed to be higher. And I'm like, well, how do you feel in the morning? Well, I feel fine. So I said, don't worry about what the tracker says. If you feel good, that's what's really important. Your subjective experience is really
Yeah, that's great advice, right? And
important.
then you know how well that intervention is working and if that's a good intervention for you. And if you
Yeah.
need to keep doing that or add something else on, I think we all need that reinforcement and that data.
Yeah, exactly. There's actually a condition coined called orthosomnia, where people can have insomnia because they're worried about tracking their sleep. So I can see it on both ends. Yeah, it can be
It,
beneficial, but it depends on the person. If you're a little bit
well,
more
and I think we
anxiety,
do get kind of
you know,
obsessive about,
yeah,
data and tracking and doing all of
exactly.
these things, right? And staying on top
Yeah,
of it. And so I definitely can see what you're saying.
right, right.
So you've told us why sleep is important and how
Mhm.
it impacts us, but what do you see? What are the biggest mistakes that women make with respect to getting to sleep?
That's a great one. And my number one recommendation is always, we don't prioritize sleep enough. And I think what's behind that is that as women, we're caregivers, we're caretakers for everyone else. And then by the time it's, 9, 10, 11, then, oh, I have some time for myself. And so what do I do with that? Typically, I myself am guilty of it. I do things that I like to enjoy, whether it's, read a book or listen to a podcast or scroll on social media. We have another term for that called revenge procrastination, where, a lot of times women are just giving, giving, giving to everyone else except themselves. And so we steal away from sleep. Whereas if you actually can get better sleep, then you're going to be more rested, you're going to be more focused, you can, be able to be more present. I know for me, when I don't get enough sleep, emotions can be really
Yeah.
affected. So more irritability. So yeah, I think we just have a lot going on and we don't take time for ourselves during the daytime. So we use a little bit of the quiet time of the night to sort of relax. So I think that's, a big one. Another thing that I see oftentimes is that we're looking for a fix in a pill or a gadget, right? If I get this tracker, it's going to fix my sleep. If I try this supplement or if I just get a sleeping pill, that's going to be my cure all. But I encourage my patients to, do a little bit more digging, be the scientist of your own life and try to figure out why. I mean, maybe being on a sleeping pill can help, but we really caution it as we get older, right? Above the age 65. And women, some of the sleeping pills, specifically the Z drugs, things like zolpidem, are associated with complex sleep behaviors. So when you take a look at zolpidem, the trade name is Ambien. It's the first medication that had a lower dose for genders, right? And so 10 milligrams, I think, is sort of what was recommended. And then they looked more into the research and they said, oh, wait, women aren't metabolizing it as much. They should only be on 5 milligrams. And so it's just really interesting how that happened with the zolpidem. Yeah. So in terms of some mistakes that I see, it's looking for a quick fix. And I think when you take a look at health and behavior, there's a lot of hacks out there. I'm sure someone's going to sell you something to try to improve your sleep. Melatonin's really big, CBD, CBN, they're all available. But is that what your body really needs? Sometimes it's just knowing a little bit of a sleep science, meaning sometimes our circadian rhythms, our clocks can just shift a little bit, where we tend to be a little bit more of a night owl. And, if you're a night owl living a day person's life, it can be really tricky because your social calendar isn't in aligned with your internal clock. So getting more sunlight in the morning is really helpful because it resets your clock and can help you fall asleep earlier in the day. I already mentioned, not prioritizing sleep. So not giving yourself enough of a wind down routine. One of my favorite saying is, when you're hungry, you eat. When you're thirsty, you drink water. But when you're tired, are you going to sleep? Sometimes people just think like, oh, I have to wake up at 5, so I need to be in bed by 9. But if you're not ready to go to sleep, it's not helpful. And then you want to slow down your brain waves, because that's really what sleep is stage one is when your brain waves start to slow down. And another good analogy, I think, is like when you go to the gym to exercise, you don't just, head off to the weights and start lifting the heaviest one. Typically, you'd want to warm up a little bit, right? Jump on the treadmill, maybe do some jumping jacks, a little bit of stretching. Same thing with sleep. I think we've been a little bit conditioned where, okay, it's, this is what the clock says. I'm going to lie down and instantly fall asleep. Well, your brain needs to slowly get into it. Give yourself a little bit of a runway. Yeah. And so I think that's also a reason why, sometimes people can
Yeah.
struggle with sleep. Yeah.
I love that advice. And I
Mhm.
think, so many of the things that you mention are really cultural, right?
Mhm.
Where we all do kind of want a quick fix and we aren't taking the time to sit back and think about the things that we're doing. And, some people that sleep well just have good natural habits,
Yeah.
right? And some of the things that you mentioned, I mean, maybe you do go for a walk in the sunlight in the morning and that, kind of gets you more awake. But those aren't things that we necessarily think about, and
Mhm.
it's hard to realize what your body needs.
Yeah. No, I think that's a good point, Sarah. And I think that's what sort of I feel like I do with my patients is I help them sort of elicit that self-awareness.
Hmm.
Sometimes they know they can't sleep, but they're not entirely sure why. Or maybe they don't know that sleep is even playing a role and they're just tired.
Yeah.
And so my intake has, a lot of questions. And I saw someone recently and she's like, oh, I didn't realize like how all of, lifestyle factors, what I'm eating, how much I'm exercising, how my kid is sleeping, how that's impacting, her own sleep.
Yeah, I mean, a lot of times you're just getting through the day, right? And not
Yeah.
thinking about these things. And I think that is kind of the lot of most moms, right? Where
Mhm.
you're, thinking about carpool and
Yeah.
lunches and, all of those things, but not thinking about your own sleep.
Yeah.
And I know for me, I think one of the reasons that I like sleep is because I know I'm a better mom when I'm
Mm,
sleeping well, right?
right.
And it's a lot of the things that you brought up. I can just be more present and, less irritable when I'm well rested.
Yeah, that's so huge. Yeah, definitely the relationship between our emotional health and our sleep health,
Yeah.
they go hand in hand.
Well,
Yeah.
and at home, I think you're the most relaxed, right? And so
Mhm.
you can keep it together when you're at work and with friends, but then sometimes at home we're on our worst behaviors.
Yeah.
Do you find, and the reason I'm asking this is because I see this all the time in my clinic,
Mhm.
but just that anxiety is so much higher these days, and it's hard for women to shut off their thoughts at the end of the day. Do you find that that's a problem?
Yeah, definitely. And some of the research to show, going through the pandemic,
Hmm.
rates of anxiety and depression have skyrocketed, I think maybe like 30% more. And another thing too is there's such a shortage of mental health practitioners.
Yeah.
Yeah, so definitely anxiety. And I always like to make the distinction when I do talks like this, is it an anxiety disorder or are we having a lot of anxious thoughts, right? Because, you know, I'm sure you've seen there's the worried well versus people
Correct.
who potentially have a pathologic condition. So if you are, thinking that, you've tried some things and, maybe some supplements or talked to some friends or did an app and still aren't feeling better, always seek out care from your primary health care physician. There's definitely a lot of resources out there.
Yeah.
But yeah, anxiety, right? If you take a look at what anxiety is, it's, having a thought where you're anticipating that it could be true, but it may not even be in fact true. So it's like looking into the future, trying to predict what can happen and really sort of assuming a negative outcome. And our thoughts can spiral. And there's something about the nighttime where we tend to catastrophize a little bit more. And I think it goes back to the way, our culture is. Like I tell my kids, it's X o'clock, it's 10 or 8 o'clock technically. They don't sleep until about 9, but stay in your room, go to sleep. And if we still have that programming from our childhood, I should be asleep, I should be thinking about all these things, man, there's something wrong with me, today's going to be awful. We tend to go down that anxiety spiral.
Hmm.
Versus, I think one of the antidotes for anxiety is learning how to speak to ourselves with a lot more compassion. So I like to encourage a lot of self-compassion therapy where,
Yeah.
yeah, we have a lot going on, and it's okay, right? Because we're going to figure it out and you're just going to do the best that you can. And another thing too is someone who has a difficult time sleeping, and you may never know when you're going to be able to fall back asleep, depending on how bad your anxiety is. And you thinking about your to-do list the next day, I encourage people to grade it on different levels. So say last night was a horrible night of sleep. Now your energy levels are low. So if I have a low energy level, I'm only going to do maybe one thing on my to-do list, or, I'm going to do the bare minimum. I'm not even going to look at my to-do list. And then if it was a mediocre night of sleep, maybe my energy levels are more medium, more average, then maybe I can tackle one or two things versus, and then the last, right? If you got a great night of sleep, your energy levels are just through the roof. Okay, I'm going to tackle all of the things on my list. And it just gives yourself a little bit more grace where, if you can't control what's happening with your sleep at night, it's going to be okay the next day because I already know that, okay, well, this is an average level of energy. I can still get things done. And so it's almost like setting the expectations.
Yeah, I love that. I love giving yourself permission to
Yes,
not have to do everything, right? Because I think we
exactly.
are so conditioned to think of the
Mhm.
day as a failure if you didn't do everything on your list, right? And some
Yeah.
days it's just not reasonable, right? So
Yeah.
recognizing the bare minimum, saying, you know what, today's a bare minimum day, and I'm going to be
Hmm.
happy with that and move on. And
Exactly.
then, it always does surprise me how mean we are to ourselves, right? I mean,
Yes.
that compassionate voice, does not come out with respect to ourselves very frequently.
No, I completely agree. And I see that often. So, what I have patients do when I work with them, I actually say, okay, what are your thoughts? And we write them down.
Yeah,
And sometimes they don't realize how negative they can be. And then we turn it around. What would you say to your best friend? What
yeah.
would you say to your son or your daughter if they were experiencing this? And,
I
you can
I
almost see
did that
that
as
the,
part of
yeah.
a coaching exercise one
Oh,
time, and
okay.
it was very surprising to me how
Yeah.
negative my thoughts were, and then
Hmm.
the experience of writing it down, how quickly
Mm.
that removed those thoughts. Right? Because once
Yeah.
you recognize them, you think, well, I don't want to be, thinking
Exactly.
that and talking to myself that way. And so it was a pretty quick turnaround.
Oh, that's good.
But offered a lot of insight, right? And it was interesting to me because I'm someone who has always resisted journaling and writing things down, and then it was,
Mm,
awfully meaningful. So
yeah.
I also wanted to ask you a little bit about sleep apnea
Oh,
and,
yes.
and when, just because sleep apnea can impact the bladder, what is sleep apnea and when should you worry about it?
Great, great question, Tara. Yeah. So sleep apnea is a medical sleep condition that affects the muscles of the upper airway. So typically what happens if you do in fact have it, it's the tongue can fall back and close off the airway or the muscles more downstream. The thing about it is it's pretty common. 1 in 5
Mhm.
adults have it, especially as we get older. Because you think as you get older, your muscle tone just isn't as strong. So there's prone for more collapse. After menopause for women, rates double to triple. And so that's something to be mindful of. And then the thing about for women is that, sure as there's a lot of gender bias in medicine. So a woman who's overweight will come and tell their doctor, I'm a little bit tired, not sure why. They're going to get their thyroid checked and then maybe put on an antidepressant and call it a day. Versus a man who comes in and says they're tired and they're fatigued and they're a little bit overweight, they'll get a sleep study. So we still see sleep apnea as sort of a male condition. There was an interesting study where women didn't think that they snored and they didn't think that they snored as loud as men. And then he actually brought them to the lab, and about a third of them who didn't think they snored actually did snore. And the decibel rating actually was really similar. Yeah. So women can just wake up with a headache, wake up feeling fatigued, and have some irritability. And sometimes those are the subtle symptoms of sleep apnea. But the typical ones are snoring, gasping, choking, and having somebody witness that you actually hold your breath.
Mhm.
And how it relates to the bladder, I love explaining this because it can, it's big. And I think of it just like plumbing. So what happens when there's a narrowing in the pipes of the plumbing in your home? Well, there's more pressure downstream. So when we take a look at if there's narrowing in the muscles of our upper airway, your lungs are trying to compensate, right? We have all these homeostatic, these balancing mechanisms in our body. So we're taking deeper breaths that increases the pressure in your cavity, your intrathoracic pressure. That extra pressure from your lungs will get transmitted to your heart. The top part of your heart, called the atria, will stretch and signal down to your kidneys to tell you to wake up to urinate. So I definitely have seen women who've use a restroom 3 to 4 times an hour. And it could be from undiagnosed sleep apnea. Oftentimes their doctor will tell them, okay, stop drinking water. And so they stop drinking water at 6, they're so thirsty, but they don't want to have to wake up to urinate. And well, sleep apnea is out there. It's a
Yeah.
big condition. So, get checked. And it's pretty easy to do so. You can actually do it in the comfort of your own home. They have home sleep apnea tests that can monitor for it. Yeah, so that's what sleep apnea
Yeah.
is.
And that's actually how I actually order a lot of sleep studies.
Oh,
And it's
great.
because I see so many patients who are getting up
Mm,
frequently at night
mhm.
to go to the bathroom, right? And so
Yeah.
then we kind of look at it and talk about it. There's a little bit of testing that I have to do in the
Mhm.
office. If it's sleep apnea, you'll often have nocturnal polyuria, right, where you're making
Right.
more urine at night because of
Mhm.
the whole system that you so beautifully described.
Right.
Um, and then, correcting the sleep apnea or treating the sleep
Mhm.
apnea reverses everything. And
Yeah.
then I think, I mean, we do see it more frequently in women who are a little bit heavy,
Mhm,
but it
mhm,
can, because it is kind of a relaxation as well,
mhm.
it can happen in thin women too, right? And so I
Yeah,
think sometimes
definitely.
women are surprised by that because they do assume it only happens to heavier women.
Yeah. And another point, insomnia is also very common in women.
Hmm.
I think just we have a lot going on and we tend to have more anxiety, and anxiety and insomnia can go hand in hand. Some of the research actually shows that if you get your insomnia treated, typically through cognitive behavioral therapy for insomnia, those waking up to urinate go down. So the
Yeah.
nocturia can actually get better, because if you're going into a deeper sleep, then your bladder is probably not going to have that signal to tell you to wake up and urinate. So if it's not sleep apnea and if you do have insomnia, you can still stay asleep longer, by getting that appropriately treated.
Yeah, I mean, there are so many things that can make you get up at night, right? Sometimes
Yeah,
it's, just behavioral. I mean, we see it a lot in young moms, right? Where
yeah.
they're getting up with their child, and then,
Mhm,
when
mhm.
they get up with their baby to nurse, they're going to the bathroom, and then they just kind of create these behavioral patterns.
Yeah,
And so
I def
sometimes it's hard to
agree.
recognize kind of what's
Sure.
going on, right? Is your bladder waking you up? Are you
Hmm.
just a light sleeper? I mean, there are so many different things that it can be, but
The
it's
art
always
of medicine.
I know, right?
Yeah.
And it's always fun and so rewarding when you can kind of figure out that root cause,
Yeah,
right?
definitely.
And fix that root cause and then see all of these downstream things improve,
Hmm, hmm.
right? Which I always like a
Yeah.
lot better than you know, trying a pill, although it does come to
Yeah.
that some days.
Yeah, and so that, they're out there and they work. So they
They
do
do.
have an indication. Yeah. But if we can, I definitely resonate with you say if we could figure out why,
Yeah.
yeah, then it makes it so much better and
Yep.
rewarding. Yeah.
Yeah, I totally agree. Well, I want to thank you for your insight and your compassionate voice. You do such a great job of explaining things and just telling us why sleep is so important. Because I think you're right. It's something that we overlook and kind of take for granted and forget or don't know how really important it is for health.
Yeah, my pleasure. Thank you so much for inviting me here, Sarah. I love talking about sleep to anyone who will listen.
Yeah. Well, hopefully more people will listen. Thank you so much.
My pleasure. Bye bye. Sleep well.